Welcome to Podocyte Talk. In today's episode, we discuss 3 recent studies that explore novel strategies for managing patients with advanced chronic kidney disease through targeted exercise timing, long-term dietary interventions, and careful use of mineralocorticoid receptor antagonists. These investigations provide valuable insight into optimizing care while balancing clinical benefit, patient safety, and healthcare resource use. We begin with a randomized crossover trial investigating whether physical activity performed before dialysis sessions is as effective as exercise during dialysis in protecting the heart. Hemodialysis is known to cause reduced blood flow to the heart muscle, leading to changes known as regional wall motion abnormalities. While exercise during dialysis has previously shown cardioprotective benefits, it is often difficult to implement consistently. This study assessed 25 patients with kidney failure undergoing 3 dialysis scenarios: standard dialysis, dialysis with intradialytic exercise, and dialysis preceded by exercise. Cardiac imaging and blood flow measurements were taken before and during dialysis. Both exercise before and during dialysis significantly reduced the number of heart muscle segments affected by reduced motion. There was no difference in effectiveness between the 2 timing strategies. Interestingly, the benefits of exercise did not appear to stem from changes in blood pressure or circulation, but rather from mechanisms inherent to exercise itself. These findings suggest that exercise before dialysis may offer a practical, equally beneficial alternative to intradialytic exercise. Next, we examine a long-term economic study evaluating the impact of low-protein diets in patients with advanced chronic kidney disease. With dialysis being a costly and often limited resource worldwide, strategies that delay its initiation can save lives and reduce expenses. This study followed 223 patients who adhered to low-protein 0.6 grams per kilogram per day or very low-protein diets 0.3 grams per kilogram per day with keto acid supplementation, compared to over 1,200 patients on unrestricted diets. Among patients who adhered to the prescribed diets and were matched to similar controls, those on protein restriction experienced longer time before reaching kidney failure and had better overall survival. Specifically, time to kidney failure was extended by nearly 20 months, and survival was prolonged by over 20 months. Although the initial dietary costs were higher, they were dramatically lower than dialysis costs over time. The study concluded that in patients who follow dietary recommendations, low-protein diets significantly delay dialysis, improve life expectancy, and result in lower long-term costs. Our third study addresses the risks and benefits of spironolactone, a steroid-based mineralocorticoid receptor antagonist, in patients with chronic kidney disease stages 3 to 5. While this medication is known to lower blood pressure and reduce protein loss in the urine, concerns remain about its safety in advanced kidney disease, particularly the risk of elevated blood potassium and death. In this large retrospective cohort study of over 8,000 patients, spironolactone use was associated with a reduced risk of major cardiovascular events, particularly stroke. However, it was also linked to a higher risk of severe elevations in blood potassium and increased overall mortality. The likelihood of progressing to kidney failure requiring dialysis was not significantly different between spironolactone users and non-users. These findings suggest that while spironolactone may offer important cardiovascular benefits, especially in preventing stroke, it should be prescribed with careful monitoring and dose adjustment to mitigate risks, particularly the development of dangerously high potassium levels. Together, these 3 studies reinforce the importance of individualized treatment strategies in chronic kidney disease. Whether tailoring the timing of exercise, customizing nutritional care, or evaluating the trade-offs of medications like spironolactone, the goal remains the same: better outcomes, longer life, and sustainable care. Join us on Podocyte Talk as we continue to bring you the most important updates in kidney disease research and innovation. Stay tuned for the next episode.